guide to dealing with annoying moms
and brachial plexus injuries.
So I really want our team to be good this year. These 10-year-olds have been playing for the Little Nuggets together for the last 5 years, but we're getting decimated by injuries. Every game I got kids crying and running off the field with their shoulders hurting. I don't know what's going on.
It does not sound good. It could be a brachial plexus injury. I would hope not at that age, but it could be. So the brachial plexus is a network of nerve fibers running from the spine through the neck and the axilla of the shoulder and into the arm. The nerve roots C5 to T1 are broken into trunks and then divisions and then cords and then lastly into branches. I know it's going a little bit in depth, but I'm just trying to explain it to you, Coach. Anyways, these nerves then innervate the muscles and the skin of the chest, shoulder, arm, and hand. So if we don't teach them proper tackling now, they could really have some serious issues later on in life.
Okay. I'm glad to know that's
All right.
what it is.
It's about time! So every day from practice, Tommy comes home with a stinging feeling down his arms. Some people say it's called a burner or a stinger. I'm not exactly sure what that means, but he feels this tingling and electric shock down his arms. I'm really concerned about his injuries. Coach, this could be the brachial plexus injury I was telling you about. Yeah. Does he have any more severe symptoms? Sometimes he says he's able to move his fingers, but not at the same time as moving his shoulder or his elbow. Again, I don't know anything about it. That could be a problem. That definitely sounds like a severe brachial plexus injury. Well, I'm worried about him. We need to get to the bottom of this. Okay. Brachial plexus injuries are quite painful, and they're often described as the burning or stinging sensation, and also crushing constant pain, which is kind of what you're describing that Tommy has. So drugs like opiates, such as morphine, hydrocodone, oxycodone, those are typically administered after the injury occurs. And so I don't know how long this injury has been occurring or how long the symptoms have been, but you should maybe consult a physician for maybe prescription drugs like that. Alright. So there are both minor and severe brachial plexus injuries. It sounds like yours might just be a minor, but I'm not sure. And if it's minor, that just means that the nerve was stretched instead of torn or severed from the spinal cord, which is always a good thing that it's not. So he won't die. He shouldn't. Okay. He should be good. So if it is just stretched, the nerve will heal on its own, but it will take time. Okay. So when can he play again? Well, that all depends. Also, severe brachial plexus injuries, and those need to be treated within the first 3 to 6 months after the injury results, and definitely within the first year. And if it's not treated within the first year, success rates decrease dramatically. So it's very important that you get Tommy into a physician and we can figure this out. And if you want, I can go with you. If there is a severe brachial plexus injury, there are 2 solutions. There's either a nerve graft or a nerve transfer that can be done. What the hell does that mean? Do you mind please explaining to me what those mean? Of course. A nerve graft is where the damaged nerve is removed and replaced with a healthy functioning nerve. And then there's a nerve transfer, which is a little bit of a more difficult procedure, which is when the nerve that has been completely severed from the spinal cord then has a less important nerve that is still attached to the spinal cord and is functioning. It is redirected to the severed nerve in order to restore function. If surgery is not performed in time, it is important to note that muscles can atrophy. So if a muscle atrophies, then the surgeon would need to perform a muscle transfer and remove a less important muscle from somewhere in the body and replace it with the atrophied muscle in the arm or the brachial plexus region. Okay. With any surgery, it is important to keep in mind that the healing process does take time, and especially with neurological surgeries. Did you know that nerve tissue only grows about 1 inch a month? I did not. So it could take up to several years if this injury is severe, just so you know, for complete function. So is there anything that we can do to prevent this from happening to Tommy and other kids on the team? Well, there is nothing that can really be done to prevent this injury because it is so severe and so sporadic, but there are steps that can be taken to reduce the risk, which one of them is proper tackling technique, which Coach here is working with the Little Nuggets on teaching them how to do it right. So, okay, Coach? Huh? Proper tackling techniques for
Oh yes, proper technique. Okay, so when we're talking about tackling technique, there's a few things Tommy needs to remember. First, he's got to keep his eyes up. If he dips his head, he's not going to see what he's hitting. Chances are he's going to hit with his shoulder, and that's when we have an injury. Okay? He also needs to get low and square up the ball carrier. If he's going from the side, he needs to get his head in front of the ball carrier so he's hitting with his chest instead of his shoulder. Lastly, when he goes and tackles, helmet face up, right to the chest, and wrap up with your arms. We don't want to tackle with our limbs or put any extra pressure on things we don't need. So we want to hit with our chest, eyes up, and get our head in front of the ball carrier. If Tommy does all those things, I think he should be fine.
Okay. So since Tommy has come home a couple times with these kind of symptoms, is there any other aspect I should be worried about?
Well, you should be aware of the chronic.
The chronic?
The chronic brachial plexus injuries, that is. I've done some research on chronic injuries of the brachial plexus, so let me tell you a little bit about it. Chronic injuries result from weakness in the C-spine, shoulder, and thoracic outlet, which will decrease the player's tolerance for impact. If a chronic injury does occur, a trainer or a physical therapist will start the patient out with some soft tissue work, such as massage, around the thoracic outlet, the scalenes, and the upper traps. As tolerance increases and movement is seen, next the trainer or the physical therapist will then work on strengthening the area, and also this is when stretching will be introduced, and you don't want to introduce stretching any sooner because it's already a stretch injury, so you want that to start to get a little tighter before you stretch it out and work that area. About 2 months into the strengthening and when obvious improvement is shown and strength is regained without pain or discomfort and too much swelling in the area, then the third phase will be introduced, which is the functional training. This is going to encompass the hitting and the tackling portion of the treatment. It's important that the athlete be watched very closely by both coaches and trainers at this time because this is when the new proper technique is being taught.
So I'm going to make sure you're on that. I will be at every practice.
I'm all over.
Okay. Good.
Other than that, there's not much that can be done, but there is preventative gear that can be worn, such as the cowboy collar, which coach can provide if you so desire.
And I have a lot of money, so I can just buy one if I need to.
Of course.
I will take every measure to make sure my son is safe.
Of course, ma'am.
Yeah. So this concludes our video presentation on how to deal with annoying moms and brachial plexus injuries.
I was the trainer of the Little Nuggets.
I was the coach of the Little Nuggets.
And I was the mom of the little nugget.
Go!